Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 104, Leveraging Artificial Intelligence in Multiple Sclerosis Care and Shared Decision Making with Dr. Stefan Ebener. Enjoy the interview. Hello, Stefan. It's such a pleasure to have you on the show. And hi to Bergisch Gladbach.
Yeah, thank you so much for having me, Nele. It's a pleasure being here.
And before we actually start with the interview, it would be lovely if you could introduce yourself to the audience so they know who is with me on the podcast today.
Yeah, for sure. So my name is Stefan Ebener. I'm leading an international team of experts for Google. And we actually help customers by implementing the most advanced technologies for real-world use cases.
Yes. And what was your personal motivation to go into that direction?
So personal motivation is quite a long journey already. So I'm with Google now for 7 and a bit years. And back in the days, it was the decision to actually join a company that has the capabilities to revolutionize a whole industry with foremost the economical power, but also great technology, and then also the willingness to challenge the status quo. And I know that Google is well known for a couple of great things, sometimes also known as they just want to have the data, what is actually not so true. But it is one of the leading technology companies in the world. And when I joined that back in 2018, it was really, for me, an inflection point to go into a totally different direction.
Okay. Interesting. So let's dive into understanding AI in healthcare. How can artificial intelligence help improve the overall management of MS?
Yeah, so you're starting with a very tough question because, what I clearly have to admit is that MS is a very complex and heterogeneous disease. Right, so it has a lot of different symptoms, progression, responses to treatments. So it's not an easy going, right? And these complexity also brings some challenges for even for healthcare professionals, but also for AI in diagnosis and treatment, and also in the monitoring. And I think with the emergence of AI, this offers also some new opportunities to improve the overall management of MS in a way that we maybe have never done before. So, for example, helping and addressing misdiagnosis, maybe late diagnosis, and also identifying in a new approach the markers that was done so far in a different way. And there are different technology aspects that we are taking into account here. So straight out to the point is machine learning for sure. Mm-hmm. But also NLP, so natural language processing, so everything related to how we interact with computers, and also computer vision. And I think computer vision is one of the things that made huge steps in the past. And so these days, a lot of systems are supported by AI to help professionals doing analysis of MRTs and all these kind of different image-based systems.
Yeah. Okay. So what are some current AI tools or systems that already support shared decision-making in healthcare? And what are the biggest challenges? I mean, we are working on a project on that and had some discussions, but maybe summarize it for our audience.
Yeah. I think this is not a surprise to the audience. There are a ton of different tools out there. The very popular one are indeed from Google, Gemini, or from OpenAI, ChatGPT. We have such tools like also Notebook LM or a lot of very specialized large language models, for example, MetLM. And I think these are good examples of how shared decision making can be supported in just interacting with the system. And you, for example, give the prompt and asking, "Hey, I have an appointment. Prepare myself with that," and then it's more like a natural conversation where the system, so the large language model, is asking questions. You can answer. You can ask questions, and then it's a natural dialogue to bring you to the point of then bringing together different aspects and information to be perfectly prepared for the conversation with the professional. One thing that I need to mention here is the public available systems are typically, because of safety regulations, refuse to give you medical advice. So they can, however, help you by condensing information, for example, and even your health records, symptom logbooks, for example, and understand also medical terms. But if you ask a direct question like, what is the, I don't know, let's say perfect treatment for symptom X, Y, Z, they always give you the feedback, I'm not a medical advisor. And I think that's an important aspect. And maybe we come to that point also later in our discussion. It's an important thing. However, you can also overcome that with, for example, local language models, or there are also some tools that you will run locally where you can just, let's say, switch off these safety aspects and then get a better advice. But that should always be used with the full acknowledge of you should know what you're doing.
Mm-hmm.
Right? Don't take that as the perfect solution.
Yes, and people always trying to get this answer from me, and I'm always telling them, I mean, multiple sclerosis is the disease of 1,000 faces, and it's because it's so variable within the community, and there is not that one medication that is perfect for everybody. So, and I think that's true for many, many other diseases. So please always be careful out there. So, could you explain how AI works in simplifying the complex medical data for MS patients?
Yeah. Simplifying is maybe the wrong approach, but yeah. So I think when I look at this, there are three main topics. It's diagnosis, treatment, and it's monitoring, right? And so we slightly touched it in the beginning. When you look at the diagnosis, it's also about early diagnosis. So helping there with maybe some new algorithms for MRI scans or any kind of abnormalities, and also then helping finding an early diagnosis and treatment plan. And then you have all these other kind of things like differential diagnosis. You have like things that would be talked about, biomarkers, virtual replication. This is an interesting point where you do something like a digital twin of a person and then running simulations. And then also like things that fits into this into the situation all overall. For example, also identifying subtypes of MS and looking for how the subtypes maybe fit into the context. So this is all what I would say simplifying in diagnosis. In treatment, I think this is where the AI magic really tries to get into the game. And this is everything bringing down to personalized treatment plans. And what we always say is the system needs to be aware of the individual context of a person. And only with the context you're able to make a personalized plan, and personalized treatment plans are definitely an important thing. It could be much more efficient then, and also minimize adverse effects, for example. And what I said, this is why a lot of topics are going into the AI direction. And when I'm coming back to what I said with diagnosis, the digital twin of a person, also in the treatment plans, for example, you can do like prediction of treatment responses. So simulating how a person with, let's say, special conditions will potentially be affected, and then choosing different therapy plans for a person. And also thinking about rehabilitation technologies. So after a treatment, what is the perfect support of a person? And here the idea is not one fits all. So it's really bringing it down to the person.
Yeah.
And I think this must be then last point is let's say brought together with the monitoring aspect, because monitoring needs also not only what is done in hospitals, so also, for example, with your wearables, where you're getting now much more data points into the overall game. Treatment monitoring. Also, the next idea is of that remote patient monitoring. What is that with wearable devices? And we're just data are much more enriched, not only from the data, let's say, out of the hospital, but also from your day-to-day data generation, to have a holistic view on how you are dealing with a treatment, also with your day-to-day maybe therapy, to improve the plan day over day. And this could only be done with advanced systems like AI-based systems.
Yeah. And if you want to dive deeper into the topic of digital twins, please listen to episode number 100, where I had Professor Tjalf Ziemsen on the show, and we were discussing that topic all in detail. Yeah. So let's go into the topic of shared decision making with AI. How can AI help MS patients and neurologists or therapists to improve communication and work together to make better treatment decisions?
Yeah. So, that's a very important topic, and I think it will also gain a lot of focus over the next couple of years. First of all, I think it's important. Shared decision making is always about personalized information. So your medical history, potentially even genetic information. We have some countries in the world, like, for example, Israel or also the US, who use that in a much broader sense than we do that. But bringing these kind of things together, also potential risks, for example, and benefits. And then helping with decision support tools. And that could be AI-driven tools, as we discussed already, but that could be also very, very much, let's say, traditional tools, just visualizing data, helping by presenting different treatment scenarios, or even helping doctors, but at the same time also patients, to discuss the pros and cons of each option with some kind of preparation and support. And so it's not only that that shared decision making works only on one side of the coin. It should be always be both sides, or let's say supporting both sides. So and then especially for MS, shared decision making could help also with that kind of risk assessment. So I think this is something that maybe in the past wasn't always a top of the priority list, but now, where we have a much broader view, and the systems are also trained to look at all aspects. So risk, assessment and prognosis, for example, could be a good an important section.
Yeah. Yeah. And for us, where we have sure one strategy being hit hard and early, a risk assessment is very important. And you might want to do that when you are younger and fitter and let's say healthier. And you might not want to do that when you are a bit older and not so healthy and maybe you just got the treatment. So this is really important for MS.
Yeah. Maybe
But
just one more
please.
last comment on that. Now we look more maybe on let's say the technical side of that, but the most important topic of shared decision making is indeed supporting communication. Communication on an eye level between the doctor and the patient, and preparing each side for a very valuable conversation. And now you have, let's say, a system that can help you by preparing that communication or that conversation. And I think this is something where AI has a unique opportunity on improving the overall decision process.
Yeah, absolutely. But of course, there are always limitations. So what are the limitations of AI providing the personalized recommendations for treatment options based on a patient's medical history and symptoms? I mean, you only know what you feed in. That's one limitation, I guess, but yeah.
Yeah, I wouldn't say that this is the limitation. I think the risk is a bit of a different kind. And I'm saying that as an absolutely technology optimist. But I think the situation we are currently facing is we see an over trust in AI. And I think everyone who listens to that podcast here maybe has seen that in the same way. When you, let's say, Google over the past and the first 3 hits, you read that and you already know, okay, somehow there is an essence of the truth, right? Because the first 3 hits are saying the same, let's say, underlying message. Now you're typing in the same question in Gemini or in ChatGPT, you get your answer, and you don't questionize the answer anymore, and you don't have an overview. So you read it and you take it as the ground truth. And this is somehow also a risk, and that critical thinking skills, you still need to have it. So, and especially when we're talking about this kind of a diagnosis or any type of treatments, you should never over trust in AI. And the reasons for that are very simple, and these are definitely the limitations. We have a data dependency and also some bias. So I think one of the most important aspects here is, and you all know that, is the lack of diverse data sets, especially in our medical history. So women are underrepresented in a lot of studies, and that is definitely that part that then also gets into these large models where maybe the answer is a very good answer for male, but not maybe for female. We have that overall data quality topic. That's true for every system that we are using, right? Shit in, shit out. I mean, it's a phrase, but it's still true. And also then historical bias, for example. So that, for example, we had that skin cancer diagnosis where, for example, black people were underrepresented, and then that could happen that most likely cancer is more detected than in with people with a more lighter skin, and that's a crazy thing, and that's also historical bias that we have. And the other thing, and we touched that already slightly, is the point of, and this is also a very important limitation, contextual understanding. So an AI system, and Nele, that is what you were also mentioning, is like has never the full awareness of the surroundings. So we call that the context, right? So maybe you only feed the system with things you think that they are important. And maybe a professional would ask you, but wait a moment, but you live in area X, Y, Z. So the air there over the summer is much more polluted than, let's say, being in the landscape or somewhere else, right? So it's these kind of contextual awareness that an important, or let's say, professional could ask that the system potentially is not aware of or not asking. And I think systems are getting better indeed. And sometimes they also come up with questions that you were not aware, or even a professional was not aware. But I think it's important that you know how the system was trained, or what are limitations of an overall system. And that circuits back to what I said in the beginning. Don't overtrust in AI.
Yeah. And I was summarizing a few episodes back stuff from ACTRIMS, our largest MS congress in the world, and there was an interesting paper on the rate of people having MS in Greenland, for example. Greenland should be very high rates because it's so far away from the equator, but it's actually not. They don't know why, but it's very low rates, and these people don't get a lot of sun. So, there are lots of things, and I had a couple, not couple, but two ladies from, let's say, was from the Black community here. And of course, they mentioned the issues with not being part of clinical trials. And then there might be things which you don't point out to the system, like me being with my little daughter in job situations which need to be taken into account. And maybe a doctor would do that because the doctor sees me with my little girl, but maybe the AI wouldn't do that. So I think there are lots of issues which are human. A human might take that into account, but not the AI. But do you have maybe a tip how to deal with, how to, let's say, start becoming on your own more aware of the fact that the AI might give wrong answers, or let's say biased answers, how we can train ourselves to become not fully trustworthy to the system?
Yeah.
Because we need to train that in a way.
Yeah. So, I mean, first of all, you can always use, let's say, different systems with the same question to see, as you maybe use Google and then read through the first 3 different hits. But then, I mean, if you're getting an answer from a system, then there are some advanced systems that also refer to the source of the information. So also checking the source. I mean, you don't have to do that for every question that is not super important, but for really important stuff, I would always check like the source. And there are some systems, I know that from Gemini, you have that little G, you can press on it, and then it gives you the link to the source where the information was coming from. And then you can also read there. I think that is an important aspect. And then, I mean, you always have the option to just do follow-up questions in going into deeper insights, like where were the sources? How was that connected? You can also ask, how was it trained? Is there a cutoff date? These kind of things. This is a bit more technical, but overall, understanding the sources is indeed a good approach. And just recently, there were also some nice other systems that was called deep research. So you can now use, for example, I know that from Gemini, where the deep research actually gives you all of the sources and information from studies, white papers, and making there the summary, and then circling back where the information was originally founded.
Okay, yeah, great. So let's move on. How can AI assist patients in understanding the pros and cons of different treatment plans?
So I mean, this is also maybe a bit of of the discussion we already had. So I think it's first of all giving information back in a very accessible and a simple format, right? So complex medical information could be very much condensed and simplified in a language that is understandable by everyone. I mean, that's why these systems are super cool and easy to have. So the barrier of interacting with the system is super low, and these days, to be honest, is like language. So natural conversations are the new interface. So you don't need any keyboard anymore, any mouse. So you can even use that on your smartphone with very, very low barrier. So I think that's important topic. Then what we already discussed, the personalized aspect, personalized information delivery, how you want to have the information, what kind of language you understand, in the sense of, I mean, always using your mother language, for example, and the modern systems can understand like 40 to 100 different languages. You can even switch directly, and they can also explain every medical term in a way that you also get it. And that also supports interactive learning. Then what we said, personalized risk benefit analysis. So these kind of things. The point is a bit what we also discussed, the context. You have to give context of your treatment plan and maybe why a decision was made in that direction. Because I see that topic, it's much more advanced than just explaining an existing treatment plan. It's also putting that or embedded that in the context of where you are, very simple things like your age, maybe where you live, what is your environment looking like, you have kids or not, you can spend like, I don't know, 8 hours on recharging your batteries, or you have 3 kids and it's even not possible. So I think it's much broader, and this is also something that needs to be part of the system. Otherwise, it maybe comes to different conclusions.
Yeah. Okay. Let's have a very, let's say, hands-on question.
Yeah.
Are there AI tools that can help patients manage their appointments, medication schedules, and follow-ups with multiple providers?
Yeah. So what I heard a lot and read a lot about is these kind of things. So first of all, maybe AI is these days more or less embedded in everything, right? So you even are not aware of that. And this is also why that is a groundbreaking technology, because you even don't know that you're actually already using machine learning for years now. And especially in these kind of medication schedules, I know there are a lot of apps that are already taking advance of AI. So, for example, just to name a few, MediSafe or Mango Health or My Therapy. So they are doing that pill reminder, also with some smart features. So, for example, adopting your personalized routine of a day, doing some predictive reminders, and also integration with other health data, what we said with wearables, for example. And I think this is something that is out there and will be used. And then I mean, this is more like the software part. And now if you do the next iteration, you already see that there are also, for example, pill dispensers, so smart pill dispensers, if you want to name it in that way, where they have logics, advanced logics. So I think I read one input or interesting company was called the Hero Health. And so they are using, for example, these detection of errors. For example, when you mixing maybe the wrong pills in the dispenser for whatever reason, also alerting then the caregivers. They track the medication part, and so I think there's a lot of innovation happening at the moment in this area, and it's quite fascinating to see that and how it could be advanced in the future. And for me, it's always like the unique combination of great hardware together with great software really helps the user or the patient in that environment to be more safe, but also just have a maybe a better life.
Yeah. Yeah, yeah. And these things, yeah, are very helpful. I mean, my treatment, I have to uh, use syringes and of course, use different spots. And if you do that for years, at one point, you don't know where you did it the last few times. And I mean, that was something that could be helped already before AI, but it's really useful. It's just small tasks, but it's really
Yep.
useful for the person.
Yep.
So when it comes to symptomatic treatment, can AI help MS patients find suitable therapists for specific symptoms such as fatigue, spasticity, or depression? Because not always the neurologist might know the right person where I should go, or the therapists are already full and I can't use them.
Uh, to be honest, this is a part I'm not aware of. So I haven't read about that or seen that so far. So the whole symptomatic treatment is indeed something that AI could easily tackle. Um, but so far, I never was in touch with such a system or was part of the, let's say, the fundamental innovational part of developing such a system. So everything when it comes to symptomatic treatments, I have absolutely no clue about that.
So probably my next two questions,
Okay.
you will say the same.
Yeah.
Okay, I have, but I still ask them. Okay,
You
just
can ask them, but what I said, everything related to symptomatic treatment is something that I'm not aware of, and I don't want to waste the time of our audience with making assumptions, because this was a part of what I said. This is the part I was never in touch with, so I'm refusing giving answers I'm not
Stefan.
aware of.
Stefan, really, but in a way, it mirrors the reality for treatment in real life. So there's a lot of things being done for medical treatment, but not so much in symptomatic treatment, unfortunately.
Yeah.
Okay, let's move on to privacy and data security. What steps
Yeah.
are being taken to ensure that patient data remains private and secure when AI systems are used?
I mean, for sure, this is a top priority for a lot of systems, and I think there are some what we call the AI principles. So that is applicable for all of the systems. When it comes to medical information, I mean, it's even more important. But first of all, it's about when you train a model, is how you can do model interpretability and also the transparency. So what we discussed, for example, is that you know that the answer is a good one or not a good one, and um, how um, how a system was actually trained. Um, I would even go one step further because I think there are some general challenges when it comes to privacy and security. Is the type of data quality and also the availability. Here, once again, it really depends on the country you're living on. For example, the UK already has anonymous data sets of patients. We are now doing some small steps into the same direction, but indeed it will take time to get there. But also the point is it needs to be part of the clinical workflow. And so far, I don't see that a lot in especially AI tools in a clinical environment. I'm trying to help a friend with um, bringing a software into the hospital environment, and it's absolutely a nightmare.
It's a pain, I
But
guess.
maybe one more important aspect of privacy and security is, and this is more, let's say, targeted to our audience. Whenever you use a system that is publicly available, you should check how data is used. So, are the AI tools, for example, collecting only user data, but is the data also stored? Is it used also for other objectives? What are the privacy policies and the security measurements behind that? So, and then also the other point is for me a bit like always use reputable providers. If this is like a super tiny startup that is based out of, and now I'm playing like the China card because of DeepSeek, like out of China where you don't know exactly where information and how information are used, I would be a bit more cautious with my health records, where I'm maybe super open and free with I don't know, let's say the data of my dog, for example, right? So it's always like the context that is important, but I think this is something that is super important, and then living in Europe has some advantages. I know that we fight a lot against GDPR in some of the areas because of bureaucracy, but sometimes it's also very, very good to have that because companies, even outside of the European Union, have to admit the GDPR rules.
Yeah, that's good.
Yeah.
How you already mentioned it, but how can AI be made accessible for all MS patients, including those who are less tech savvy or have other barriers they need to overcome? I still want to have it here as a question, even though you mentioned it already.
Yeah. So, I mean, the great thing for the moment is we are moving with light casting speed into what we call a multi-model world. So whatever kind of interface you want to use, for example, voice or an image or a video or screen sharing or even just typing in text. So whatever kind of interface or let's say model you have, you can use it. So, and a standard voice is the new standard interface for everything you're doing, and I'm pretty convinced that natural conversations with your system, with any kind of system, will be the future. And for example, now speaking from Google is I'm using a Google Pixel phone. Gemini is naturally embedded, so I can just say, "Hey Google," and then ask my question, or even just make a picture, a live stream of my desk here with my notes, and he will use it, and then I can ask questions like, give me a summary of my notes, doing X, Y, that, right? So who I'm talking to. So I think the barriers are going down and down, and this is it's a crazy world with great technology leaps, and it's quite fascinating to see how rapid we are moving on, and that's why I think it's not only for MS patients. I think it's for the whole medical environment, a new era. But it's on us to have a faster adoption to the systems. And this is something where, especially in Germany, we sometimes lag a bit behind. I think we made progress. We made a good progress. And I'm also talking to a lot of doctors who said that I'm actually using a lot of the systems, privately. And I wish that we're also getting into a system, but having a medical product implemented also needs certifications, and then there's a lot of other aspects for good reasons, for safety reasons, to get it there.
It's a lovely German bureaucracy, yes.
Yeah.
Okay, yeah. Why are AI tools only a supplement but not a substitute for medical professionals, at least as of now?
Yeah. So I think that will maybe change in the future, but maybe not as fast as we all maybe wish or are afraid of. But this is what we also touched multiple times now. I think it's the lack of a holistic understanding and context. And you can say it also very technically because AI always excels somehow pattern recognition and data analysis, right? And for sure, it can process a vast amount of medical data like image, labs, all the records you have, and predict also risks. But it lacks always the human ability to integrate this into findings somehow with the patient's overall context. So what I said, like you have 3 kids, you're not able to always do your morning routine with, I don't know, some stretching exercises whatsoever. And this is also, I mean, this is also the big opportunity for these kind of systems, personalized treatment plans, diagnosis, these kind of things we already discussed. Um, but here, I think the human still is able to just have more context, and especially if you have a serious a diagnosis, it is a journey, right? It's a journey about multiple years, and if you are getting in touch with a professional over these kind of years, he or she knows you and can just bring a lot more topics into a context. However, I'm 100% convinced that that human is even more powerful if he or she uses AI to just make himself more aware of new maybe studies whatsoever. So I'm always saying a human is not in a direct fight with the machine. It's like human with machines versus human without machines. Yeah, I think this is
Absolutely.
also true. This is also true for the medical environment.
Yeah. So true. I was in a restaurant with my best friend yesterday, and we were talking about that. That I think it will become really hard for people in the job environment if they don't use AI, because it can make you so much faster and uh, improve quality of your work and all that. And of course, it's true for doctors as well. So what are the most exciting developments in AI that could revolutionize MS care in the next 5 years? What do you see and
Yeah.
think?
So the multimodality is one of the top things. So also integrating data from different sources, whatever they are, structured, unstructured, text, videos, whatsoever. I think this is one of the things that already starting right now. Um, Another topic that is super interesting is real-time monitoring or real-time data. So far we're always talking about your medical records. I mean, this is data that was recorded and will then be processed more in a batch mode. But having these kind of real-time monitoring, for example, of symptoms and also predicting some potential relapses, that could be really a breakthrough. But that would also mean that you are much more taking care of your wearables or using more wearables. And I'm not talking only about a watch. So there are a much more of advanced wearables in the medical environment that could be used. And and then what I also see, this is one of the observations from the US, is AI assisted clinical trials. So where they're doing that matching of patients to studies in a much better and faster way, and with a lot more of data points. And I'm super convinced that this will also get to Europe very fast, because the advancements or the benefits are definitely there, are much more efficient, and bringing also new treatments even faster to the patient. I think this is where a lot of people are waiting for. And so multimodality, real-time data, and then these AI assistants for example, for clinical trials. You also another area.
Yes, fantastic. And I think there are great chances for the people with progressive MS who are still waiting for good treatments. And I think there will be a lot of breakthrough coming in the next years. My daughter doesn't want to do the interview anymore. Could AI be used to create virtual support groups or connect patients with similar experiences?
Yeah. I mean, I think this, with all the respect, is a bit from a technical point of view a no-brainer, right? Because it's actually that matching and just trying to analysis, let's say the different data points, and then bringing it together and making the connection to various groups, and that's already out there. It's used in different fashions for different systems, and I mean, technically not a big issue. It's more the willingness to also apply that to the medical environment.
Fantastic. And my last question, what advice would you give to MS patients who are curious about using AI tools to manage their condition?
Yeah, so I think, first of all, AI is embedded and it's not always seen. So you potentially already using some of the tools and systems that are, as we call it for now, AI enabled. But also, especially for MS, I think there are some interesting applications out there, and there will be a few coming. I'm already aware of, like, for example, symptom tracking apps, right? So where AI is really used to identify triggers, for example, and also then condense these kind of information and share it with the doctor if you wish to. We talked a lot already about the wearable part. They are getting more advanced over time, and so, for example, they already detect changes in mobility or also in other MS-related symptoms, and they can use in a way more advanced way as we do it now. And then I think also, and we talked about that in the beginning, is that kind of personalized medicine. So analyze your individual data points. You have to give it to the system indeed, but then also predict, for example, the different treatments, the personalized care plan, and but then also feeding back the system with, for example, with changing symptoms, with like you may be using a logbook that you're also treating into the system, and maybe also image analysis of MRI scans. You potentially use these kind of things. So I think this is something that a lot of the tools are already doing and will do even better in the future.
Stefan, thank you very much. It was an interesting interview, and I'm looking forward to meet you at one or the other occasion in the future, and let's see what AI brings to us. So lots of good stuff, but also be curious and don't trust the system all the time, as Stefan mentioned a couple of times. And yeah, thank you.
Thank you so much, Nele, for the invitation and the great work you're doing here. It was absolutely a pleasure being here.
Thanks. Bye-bye.
Bye-bye.
I hope you enjoyed the podcast and learned something new, and maybe can work with AI even better. That would be great. By the way, next time I will be talking to Zumara Ahmed about the Zumara Foundation and NMO and how her journey is changing lives worldwide. This will be interesting again. Of course, this will be focusing this time on NMO, NMOSD and MOGAD, but I think it's really worth listening to it. So please tune in again. Please recommend the podcast to other people who might be interested in it, and stay as positive and active and healthy as possible. And see you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.